there has been a love-hate relationship between our culture and doctors and medicine. Some cynicism, and not just now, not just our culture, but a lot of cultures where people are allowing people to make medical decisions who do not have medical backgrounds. I think from the African American perspective, or Black, or however you want to phrase whatever the common term is in your community for that, our history with doctors has not always been good. And so from generation to generation, there's a skepticism passed down, the Tuskegee experiments and all of that kind of stuff. How do we begin to rebuild trust? Because you can prescribe all day long and you can talk all day long, but if I don't trust you, how in all the noise of what is right and wrong do we differentiate and understand what can be trusted?
Well, I think you mentioned the Tuskegee experiments. My wife's grandfather was a part of those gentlemen that were experimented on. We have Henrietta Lackey, the HeLa cell. I think Oprah produced a story about her. The woman at Johns Hopkins, where they produced the immortal cell line. She had cervical cancer. They never told her what she had. We know that they experimented on young African-American men and women at the turn of the last century to learn. And so that created a huge distrust in the African-American community. I argue with my patients a lot because they come in and they tell me, Dr. Google said this, Dr. Google said that. Yeah. And I remind them that, that's different than a double-blinded, retrospective, peer-reviewed journal where a bunch of experts have gotten together and debated, the safety and the efficacy of a drug.
Right.
So I think that it is up to us. We need to educate more people like us,
right,
that connect to us.
Right.
It could be 2:00 in the morning. You got a surgeon you can call.
Right.
You have a primary care physician you can call.
Right.
And I think, again, it goes back to empathy and connection. I think we have to have those connections. I think we need them now more than ever.